So, and we get this a lot is people will call us and say, I've been diagnosed with anxiety. And very often say, I've been diagnosed with anxiety and depression. So the thing is, with both of those are categories. So they're not a singular diagnosis. So when I say I'm anxious, that's different than if I say I have a specific anxiety disorder. So when we talk about anxiety disorders, we're actually using something called, let me actually copy it right here, this fun book. And this is actually a manual that we use, and this is based on data-driven scientific approach in regards to coming with diagnoses. In the same way that how do we define like diabetes, or how do you define something like obesity or cancer in that same way? So there's specific markers that people have to hit for different disorders. So with anxiety, we have a classification of disorders, anything like I was just describing, from general worry, a lot of future what ifs, to fear of certain situations. So it depends on what we're looking at. But one way to generally think about any sort of disorder is it interfering and or is it distressing to me? So the level of interference: can I get out of the house? Can I go to my job? Can I take care of my family? Those are levels of interference, to more personal things of like, I'm just not enjoying life anymore. To that goes into the level of distress. I just feel kind of overwhelmed or unhappy. I'm really distraught that I even have to deal with these things. So when we have a level of interference that becomes problematic, I can't get to my work, or work is very difficult for me, and I'm so tired by the time I get home, I can't do anything. Now we have an issue, regardless of the type of disorder it is, be it a mood disorder or anxiety disorder or otherwise. So one of the major things we look for first is how big of an issue is it, and then we start looking at which criteria does this type of anxiety disorder meet for. However, in general, with anxiety disorders, we're talking about a level of worry, either current with how I feel physically, future oriented in regards to situations that might be specific, like fear of an animal or fear of a specific environmental issue like water, like fear of water or drowning, to just a lot of what ifs. What if I don't make it to college? What if I never get married? What if my wife hates me? What if all of those sort of thinking patterns? So in general, when we talk about anxiety, it's kind of like that typical term we're using is what we expect, that worry and fear of either current things or future. Rather than trying to relax or work or get away from anxiety provoking situations, we actually want to learn how to walk through them and learn how to be able to handle them better.